My name's Claire, for those of you that don't know me. I'm a neonatal consultant at the Homerton, and Selena has asked me to talk to you guys about the kind of applying for a consultant job and that process. So what I'm going to try and cover, if I can get my slides to move, is the first part, so the CCT process and how that actually happens, go through the consultant application form and explain about the consultant interviews, but mainly focus on how you can use your last year or so to prepare for this process. And so in red, you'll see tips along the way. It's obviously being recorded and will go on YouTube. And I've obviously put quite a lot of information on the slides so that you don't need to kind of write it down so that it's there. And if anyone wants the slides, I'm happy to share them. And you can just email me. It's just claire.howarth@nhs.net. So just to put into context for those of you that don't know me, so I am was a neonatal grid trainee. I also did a research degree between my ST7 and ST8 years. And I did CCT early because there was a job I wanted to apply for. So I CCT'd early in March 2019 and then went through that process of not having a job, because if you CCT early, you're not given grace. So did a post-CCT fellow at NTS. Just the caveat to my talk is that I knew where I wanted to apply, so I was really keen to work at the Homerton. I'd worked there as a grid trainee and done my research there, and I was very lucky to get appointed. So I started in July 2019, and then I've been education lead from December 2019. And having been through the consultant process with those various steps in it that are a bit different, it is quite stressful, and actually I don't think there is a lot of clear information. So what I'm hoping to do is to spell out what happens to make it easier for all of you. So your CCT process is all on your e-portfolio, and the CCT form appears once your outcome 6 has come up on your ARCP. And basically the same way as you would do anything on ePortfolio, you go to create new event and that completion form will arrive. And with that, you need to prepare your RCPCH CV. And just so you know, that CV is very different to anything that you will have prepared before. It's not the usual CV with kind of like presentations, management. It's more focusing on the jobs, and it asks you what you learned in the job, what your role was, and your on-call rota, things like this. So again, red is the tips. So the main tip is to start doing this before. Do not wait until your ARCP outcome 6 comes to start thinking about this CV. I'll go on to the CV in the next slide. What happens when you submit the CCT form online is that the college review it and check that you've met the training requirements. And then they send a recommendation to the GMC and you're emailed to let know that that's happened. And then the GMC contact you to say that they're going to put you into the specialist register. And they won't do that until your training is finished. And just to bear in mind, this whole process with the CCT form, it can take up to 6 weeks. And that's why as soon as you get your outcome 6 from the ARCP, you should start the form. And if you already have your RCPCH CV done, it will make your life easier. So just the RCPCH CV, I've just screenshotted a couple of pages of mine just so you can see what it looks like. So you start with your normal personal details, and then it has a career statement, which is essentially what the goal of your career is. So for me, it was that I wanted to work in a tertiary neonatal centre. For some of you, it might be that you want to be a general paediatrician with or without a particular specialist interest. And then the rest of the CV is just your general career history, starting from F1 to date. And it asks you for your on-call rota. It asks you what obviously you did and what your roles are. So for example, you can put for F1, I put daily ward round led by the SHO registrar, coordination of patient care, admitting acute referrals and reviewing, assessing patients on the ward. So you just need something like that for each of the posts, and you have to put the address and also who your educational supervisor was. And if you are less than whole-time equivalent, then that would go on the CV as well. There is really clear guidance on how to write it, and there is an example CV. Obviously, if you have the slides, you can click on this link, but also if you just Google RCPCH plus CCT, it will take you straight to that form. And it also goes through any frequently asked questions. The most common one is how to input your on-call rota. And what I would do is make sure you speak to colleagues, because most of you will have done the jobs. So most of a full-time on-call rota is 1 in 7. So for instance, I worked at Northwick Park, that rota is 1 in 7, but when I was at Queen Charlotte's, that rota was 1 in 8. So it's just worthwhile speaking to anyone you know who is there to clarify the on-call rota, or speaking to the rota coordinator from when you were there. But most of the time it will be 1 in 7. And then this completion form. So just to show you, this is just a screenshot, and just bear in mind mine is slightly different because it was a grid form. But when you open it, it will ask you just to double check that you've had your ARCP. It asks you when your exams were completed, where you're doing your training, and then if you're doing any grid training. And then again, it will feel like repetition, but you need to add your training posts. So if you've put them through your ePortfolio as you go through, then it will generate them, but you just need to check that it's right and there are no errors or overlaps in the dates. And then it asks you to attach your RCPCH CV to the form. And that's why I'm saying if you start the CV early, it makes this form process quicker, because you can't submit this until you have that CV attached. And then it asks you about your training time, which is done from your CCT calculator that you'll do with your ARCPs each year. And then for the grid form, it goes to the CSAC representative. For general peds, it will go to the college and they confirm that you've met the training, and then it will get the final admin check here. And once you submit it, when you look on your ePortfolio, it's a bit like the MSF, so it will have the green and red dots letting you know the progress through those stages. And the final stage is that the RCPCH officer signs it off, and they'll confirm that you get the CCT. So main tips for this is do it as soon as your outcome 6 is available, and the sooner you start it is the sooner you get your CCT. And like I said, with like the MSF, you can see what stage your form is at. And just a little tip, if it stays with one person for longer than a week, then just you can email them a polite reminder, particularly if you need your confirmed CCT, if you've got a job lined up. It's just worthwhile, because for some people, they might have gone on leave or they might be inundated with them. So just a gentle, polite email, and then the form will go across. So I think for most of you, this is obvious when you're thinking about your consultant jobs, but for some of you, you may have absolutely no idea where you want to work if there isn't a particular department that you're desperate to work at. And my main tip, having done the last 2 years, is make sure it's a location that fits with balancing the rest of your life. I have a really long commute. I chose that because I wanted to work at the Homerton, but it is super long. It's 4 hours out of my day that is commuting, and that could have a massive impact. So make sure you really think about location. If you have an idea about where you want to work, sound out if there are jobs coming up. If you're like me, that can feel a bit awkward, but everyone's doing it. And they'll know if they've got jobs coming up, and they'll know if they've got trainees that they're interested in. So don't be kind of worried about approaching people and asking if there are jobs coming up. In terms of specifics, if you've got a specialist interest already, then great. If you haven't got one and you're thinking about applying in a certain area, then just have a look at that department and what they have already. And so if you're applying for a job and you've got, say, endocrine as your specialist interest, but they've already got 2 consultants working there with endocrine as their specialist interest, then that's going to make you less marketable than if there's someone with a special interest they want. Bear in mind, if you're applying for a replacement post, then it's a good idea to have your special interest as what the replacement had. And it may well be that a lot of you can cater your specialist interest. So it sounds quite daunting to think about that in ST8, or if some of you will be before that. But if you've done lots of teaching or you've done a project in something, you can align that with applying for a post with a particular interest. It is important to look at the timing of the posts. Not just for when you can apply, but also if you need to be thinking about your grace period, or if you're like me in CCT early, where you're going to apply for that post-CCT job while you wait for the consultant post. Most consultant jobs start as locums. There will be a few that will start as substantive. And if you're unsure of an area, a locum is a good job to apply for to see if you like the department, and it gives you experience as a consultant. And I'm sure you guys know this, but don't underestimate the importance of the people. So most of the departments will be the same in that you'll see similar cases. Your workload as a consultant will be very similar. It's the people that make the difference. And you need to be thinking about fostering relationships, particularly if you're kind of the ST6s, 7s on this call, and you're going to an area that you want to work at for ST8. Make sure you're presenting yourself in absolutely the best light when you're there. So just some tips for you from that respect. It may seem really early to think about it if you're not currently an ST8, but joining NHS jobs early really gives you an idea of jobs that come up, and you can see the specification, person specification, and what the consultant application forms are like, and it just gives you an idea before your dream job comes up. And make sure you know what the difference between direct clinical care and SPA, supporting professional activities, are, and therefore what consultant job you're applying for. So to put it really simply, DCC is anything you would do clinically. So for me, that's ward rounds or clinics. And SPA, we tend to summarise it by calling it our admin week. But it's anything that doesn't involve direct clinical care. So that might be writing up letters from your clinics, it might be responding to complaints, doing a root cause analysis. All of that fits in your SPA. And so the standard full-time consultant job is 10 PAs, and it's normally split with 8 DCC and 2 SPA. And just a word of caution, if you're applying for a job and it's split as 9 and 1, just bear in mind the workload. You may wonder as a trainee, I certainly did, what your consultants did on their non-kind of clinical weeks, but I can tell you it's a lot. And if you had 9 DCCs and only 1 admin, that workload would feel quite a massive jump up from what you do as a trainee. On NHS jobs, if you do fill in a form, let's say you apply for a job and you are unsuccessful or you change your mind, it keeps the data from that application form. So you can auto-populate the next form if you decide to go to a different job, or if you're applying for more than one, so you don't have to write the same thing over and over again. And just bear in mind, you can apply for consultant jobs where the interview date is within 6 months of your CCT. So in terms of the consultant application form, it will never be too early to think about it, whether you're currently an ST8 about to CCT next month, or whether you're ST6. Generally start thinking about it as soon as you can, even if you're not sure you're going to apply for a consultant job straight away. You might be thinking of doing a post-CCT fellowship somewhere. It just helps you see any gaps that you've got that you can address for the form. Compared to any other form you will do, particularly compared to the grid form, the word counts are very limited. So for a lot of the questions, it's 50 words, and there are a few that are 250 words. So just, you need to be really good at selling yourself with no waffling. And the biggest tip for you is to go onto NHS jobs, find any consultant job, and read the person's specification, because it gives you an idea. And all of the specifications are split into desirable and essential. Everyone who applies has the essential. So what sets you apart on the form in order for you to get an interview is how many of the desirable criteria you have. And the desirable criteria are marked throughout the form. So you just need to try and make sure that you get in as many of the desirable criteria you have by referencing them in various stages of your form. So what I thought would be helpful is just to go through the form and give you an idea of what you need to put and if there are any specific tips. So the first part is your qualifications, so that's e.g. list your degrees and your RCPCH. And then the first question after that, it asks you for relevant training courses that you've attended. And just bear in mind what it's asking you. It says clinical, leadership, research, teaching and professional. And it's in the past 3 years. So if you were someone who was super keen and did loads of courses, like maybe you did leadership and management in ST5, bear in mind when you're applying, you won't be able to put this on the form. And you can only put 7 and it needs to be the last 3 years. So a big tip, if you've not done them already and you're ST 6, 7 and 8, think about the leadership and management and supervision courses, which are the ones that I would recommend are in red. So to put it into context for you, what I put as my 7 was NLS. So for those of you who are general paediatricians, APLS should be one of your courses. The second one I put in is a part of grid training. There's like a preparation to be a consultant, which is called peak performance course. So if you've done something like that, that's useful. And if you've done any particular training course that was slightly more long-winded than just going on a training day, that's what that neonatal neurology course is. You could put something like that. And then important ones to put on are if you have any teaching qualifications, such as teach the teacher or train the trainer, doing a leadership and management course, and also the RCPCH effective educational supervision course. And then generally, if you've got ones left, it's thinking about what courses demonstrate your commitment. So that's roughly what this question is asking you. It's checking that you're qualified to do the job, but it's also looking at how committed are you. So just think about, out of any of the courses or conferences you may have been to in the last 3 years, what ones kind of demonstrate a bit more commitment. The next bit is employment history. So you just, again, you'll get bored of writing your employment history, but again, you list the last 10 posts. So you won't necessarily be going all the way back to F1. And for each one, you give a summary of your roles and responsibilities. So I also recommend you start writing this now and not leaving it to when you're doing a consultant form last minute if your dream job pops up. Sometimes the delay between when you apply and when it closes can only be a couple of weeks, so you don't have a lot of time if you're on a busy rota. And what I mean by your roles and responsibilities is, let's say you're talking about your tertiary NICU job. You say, I worked in a busy tertiary NICU in East London where I covered postnatal ward, labour ward and neonatal intensive care. I gained experience in looking after extremely preterm infants as well as managing the 6-term infant. And then you would add, I'm competent in high frequency or whatever ventilation, and then what your roles are. So if you were trust rep on that post, or if you carried out an audit project or led a quality improvement, that should all go in there. And this can be the difference in the application form. So someone who literally just lists their job and says, I was the neonatal registrar, or I was the on-call for A&E, compared to someone that actually goes through and puts the time about what their roles and responsibilities were and shows how much they gained from that job and how it makes them more suitable for applying for the consultant one, will definitely make your form stand out from the other people. The next one is your practical experience that's relevant to your post. So if you're applying for something like neonates or a special interest in neonates, you'll have more procedures to put in. If it's a general paediatric post, your procedures will be less, but things like lumbar puncture, anything that would be relevant to the job that you're applying for. Obviously, if it's neonates, it's easy. There are lots of procedures that you can put in, and it asks you your level of experience, and you put that by putting a number, and that number can be checked. So make sure you've got it backed up in your e-portfolio in terms of your skills log, rather than just picking a number from thin air. The next bit is after you've listed your experiences, it's your procedures, sorry, it says, please briefly describe the extent of your proficiency and experience in the procedures above, along with any particular clinical skills, experience or special interest you may wish to highlight. So things to think about here is you've said you can do X procedures, and whatever that is, you need to make sure that you're selling yourself. So you could sell yourself by saying you can do that procedure in different ages, different gestational ages. So let's give a paediatric example. So for example, you could choose something as simple as cannulation, but you could demonstrate you have awareness of distraction techniques and that you use the child play therapist. That makes your answer better than someone who's just said they're able to cannulate. You need to think about whether you've had any feedback on your teaching procedural skills. So could you use that and say that not only can you do X procedures, you've received excellent feedback for teaching juniors, or perhaps colleagues have commented on your procedural skills on your MSF feedback. And if you're someone who had numerous procedures to put down, but you can obviously only put 8. If there are any that you want to highlight, then you would put that here. And again, look at the desirable criteria. If it's somewhere where they're saying desirable criteria is someone with echo experience, you need to make sure you mention any proficiency you have, such as courses or number of echoes you do in this section. The next one is, in the context of this post, in reflecting on your own skills and abilities, are there any areas where you might seek further development and support? And that's a really fancily worded, what are your weaknesses question. And that will come up in the consultant form in some way or another. Most of the time it's to do with these procedural skills. And the way I approached it was that I knew that they, in an ideal world, were looking for consultants with echo experience. So I addressed the fact that I hadn't done a formal echo. I mean, I've done a course, but haven't done the formal echo training. And so said that I wanted to gain more experience in that. And then remember what you're applying for. You're applying for a consultant job within a team and recognising the importance of that team. So I think saying in there that you want to learn from the others within your team, and I mentioned particularly management experience, such as budgeting, resources and strategic planning, because that's not something you do much as a trainee, but it is something you will get very familiar with as a consultant. I think that not only addresses your weaknesses, but it shows that you know what the job entails and you know the areas that you are lacking in. I'm just going to pause because a question has come up on the chat. Please feel free to put them on the chat as we go on. So Neha, would skills logs that we complete ourselves on Kasian count towards the procedure numbers rather than docs, as a lot of procedures done by registrars are not supervised? Yes, it doesn't have to be a docs, Neha. Putting it as a skills log is fine. It's just so that someone can't say, oh yes, I've intubated 200 times in my paediatric training, and then have one docs in the portfolio. So randomly across the country, they will spot check some of the applications, and you just want to make sure that whatever you say, you can back up. So I'm not saying that you might have 200 skills log, but if you've got lots of skills logs and then you've got assessments where they've said in the MSF, Neha is competent in intubation of preterm and term babies, then you've got that evidence. And then Katie, sorry, I didn't see this one come up before. In terms of the on-call, so that's going back to the RCPCH CV, what is the purpose? So yeah, Katie, it's to do with the time in training. It's to check that you have done enough on-calls. So for some people who do GOSH as their rotations, like I did as an SHO, you don't do, obviously, well, when I was there, you don't do nights. But don't worry too much about the on-calls. For those of you in the Stepping Up group, that is a lot of focus. And when we get through the next month, I'm sure there'll be lots more messages about it. They can do the checking of the on-calls and your time in training from the CCT calculator. So even if you've put the wrong on-call number, or let's say you literally couldn't find out what it was when you were there, don't worry. You can just say, if you have the rota, you can say, I worked 6 weekends out of the 6 months, and they can work that out. But it is just to do with checking the time in training and that you've met the training requirements, because it's recognised that your on-call shifts, such as weekends and nights, are really important to do with the learning. Okay, so next part of the form is please provide details about your teaching experience. And I just want you to think about what you can put in this answer, because you all will have loads of it. So think about it in a systematic way. So you'll get more points if you've done undergraduate and postgraduate teaching. So undergraduate is any evidence of obviously medical student teaching. Postgraduate is obviously teaching other colleagues, such as other doctors, but also extra brownie points. Have you been involved in allied healthcare professional teaching? So for instance, have you helped midwives with learning their NIFEs? Have you supported nurses who are wanting to learn how to take bloods? Think about the types of sessions that you offer, so you can demonstrate that you're able to teach in various formats, such as you've given lectures, you've held workshops, you do bedside teaching throughout the day. It may be that you've taught on or you've helped organise some of the regional training days, such as the RSM days. So I know some of you have already been involved in organising these. If you haven't, it's something that's relatively straightforward to do, particularly if you've got an area that you're particularly interested in. Like if you're interested in paediatric A&E or respiratory, then you could ask to get involved with that particular day. And again, there's a link to the website there so that you can contact the relevant TPD if you would like to help. But also if you just go onto the London Paediatrics website and Google the RSM days, they'll come up. Also in your experience, don't forget to add in feedback you've had for your teaching. And yeah, it's cringy on these application forms saying I've received excellent feedback or my skills have been rated 5 out of 5 or however you want to phrase it. But everyone's doing it and everyone needs to sell yourself. So if you have given any particular teaching where it was scored, you know, where you might get rated out of 5 for your teaching, or if you've got a really succinct comment on a lecture that you gave from a feedback form, you could add that in. You'll obviously get more marks if you're an NLS or an APLS instructor, or obviously given the COVID delays, it may be that you were nominated and you have or haven't yet done the GIC, but put that level of detail into the form. And for those of you not ST8, so have a little bit more time, if you are not already an NLS or APLS instructor and it's something you'd be keen to do, you may want to think about recertifying on those courses earlier than the 4 years, to see if you could get ICs, that means recognised as having possible instructor potential, so that you can then put that on your form. The one advice for you for the forms as well is don't just do things to put them on the form. Do it because it is something that you generally want to do. So you don't have to be an NLS or an APLS instructor to get a consultant job at all. But if that is something that you would like to do anyway, then it is worthwhile considering recertifying earlier in order to put it on the form. The next question is, do you hold any particular qualifications in teaching? And just to list some of the qualifications that you may or may not have. So teach the teacher and train the trainer we spoke about. Some of you may have done the London School of Paediatrics simulation facilitator course, that sort of thing can go there. The educational supervision course counts as a teaching course because it's teaching and mentoring, so that can go in there. We spoke about NLS, APLS. There's another teaching course called Teaching Improvement Programme System. And for some of you, you may have already done one of the postgraduate certificates or diplomas. You don't need to have done all of them by any stretch, but if you have done a course, make sure you put it in there. And like I said, if you've got time before you're a consultant, I would definitely recommend doing either Teach the Teacher or Train the Trainer and the Effective Educational Supervision course. So the next section of the form focuses on management of change. So that can include audits, quality improvement projects that you've done. It has to be over the last 5 years. So just bear that in mind. If your best project is actually from when you were ST1, it's not going to be relevant when you're applying in this form. And it's very wordy, the question, but it says include the aim and outcome, whether you led the change independently or whether you worked under the supervision of a senior. And there's only 50 words for each of these. So you need to make sure that you address each part of that question. And you can only give up to 5 and it's most recent first. So think about things that show you in the best light. So if you've done a quality improvement project, did you show a significant change? So for example, compliance with X went from 66 to 90%. Or conversely, did you do a quality improvement project and didn't get a change, but learned from that why you didn't get a change, and that will help you in the future? If you're going to put an audit there, again, make sure it's an audit where you completed the cycle, or if you didn't complete the cycle, it's something that affected change. So as an outcome of your audit, local practices were changed or pathways were reviewed. Remember, it's saying management of change, so think a bit outside the box. It doesn't necessarily need to be a quality improvement project or an audit. It could be setting up something. So I know for a lot of us, COVID has meant that we've had to be innovative with the way we're doing our teaching and training. And is it that you've been involved in setting up a new course, or you've been involved in setting up some sort of training? I was involved in starting the NLS course at Homerton, and so I put this in the management of change option. So just kind of think about what you've done over your paediatric training, and remember that management of the change isn't just audits and quality improvement projects. You may have done something else. And then when you've listed your 5, it then asks you which has been of the most value and why. Again, it's really strict, it's 50 words. So think about your projects and think about what they're getting at with asking about value. So that could be value to you as the individual. So what did you learn from that that's going to make you a better consultant or make you better implementing change in the future? But the way I looked at this, and I don't know whether that's necessarily the right or the wrong answer, but I got my job, is thinking about value in a bit more of a wider context. So what would it do for the trust? What would it do for the department? What does it do for the staff? Does it have an impact on the patients or the families? And then that value can be financial or personal for the wider team. And thinking about structuring your answer like that is a lot more how you approach business cases as a consultant. So you're looking to expand your unit, you're looking to hire another consultant. You have to think about the benefits at each of those levels. And that's what these questions are getting at. So as an example, I use setting up the NLS course. So for the trust, spoke about revenue, spoke about the fact that we were the only tertiary centre in London that wasn't currently offering it. For the department, it meant that we could train more of our nurses, midwives and doctors in-house and them not having to go to other centres. And we could also offer it at a discounted rate. So obviously that benefits the trust as well. And then you can say that it benefits the patients and families because you're going to be offering better care by making sure that more of your staff are trained in resuscitation. So just have a think about things you've done and think about how you would answer which one has been the most value. So the next one is describe the impact of a change initiated by you on wider members of your team. And again, this doesn't need to be a big change. Maybe you redesign the handover sheet. Maybe you redesign the induction information given in the department that you're working out. Think about something you've done already. You all will have done something that affected your team. And then just think about it a bit more. It says wider members of the team. So not just doctors, think about the nurses and the rest of the MDT. And could it be the families as well? So mine was I, with a colleague, audited attendance at deliveries when I was a registrar. And we found we were being called for things we didn't necessarily need to go for, like elective caesarean sections. And so I looked at the impact for the doctors. If they weren't going to deliveries all the time, the labour ward SHO was around more time for ward rounds in terms of learning clinical management and learning procedures. If the team wasn't so busy going to labour ward, it improved the nursing efficiency because the team would get their prescriptions done earlier or address any problems the nurses had raised. And then finally, when I was working at Homerton at this time, ward rounds, parents weren't present on the ward round. So they could only come in once the ward round had finished. And you can imagine if your SHO and registrar are constantly at deliveries, the ward round is a lot slower. So emphasising that by doing this audit and changing the guidelines, we were able to finish ward round sooner, meaning parents could come in. So it was a really simple project that you can describe in a much kind of deeper way to make you more important as a kind of consultant application. So think about anything you've done. And like I said, it could be as simple as a handover sheet change. And I'm just looking because there's a chat question that comes up. So do you know if it's just time in training that counts to the time deadlines, e.g. in the last 3 to 5 years, is time out of training discounted, e.g. parental leave? So on my application form, there was a little I, like the information on the question, and when you opened it, it said last 3 to 5 years of your training, which means obviously if you had time out for other reasons like maternity leave or parental leave, that you could go back slightly further. I assume that's what most consultant forms would do. If you have done it and it's very close to the 3 or 5 years, but it's because of maternity leave or parental leave, I would suspect that's absolutely fine. What I would do is just in your department, it just says PICU here, but whoever it is that's asked that question, just ask the newest consultant in your department or the clinical lead who would do the adverts for consultants, what they're allowing. Most people, it would be allowing for people having had time out for maternity leave or parental leave. So the next one is please summarise the main learning point from an effective audit or quality improvement project you've undertaken. So hopefully you can see from this form there is a lot of emphasis on audits, quality improvement, change that you've done, but not just what you've done, how it's taught you things. So just think about something that you've done and why was it effective? So why did you achieve the outcome you wanted? Or equally the converse, why were you not successful? And then think about how you would put the learning points in there that capture the desirable and essential criteria of a consultant that would be on that form. So I did something really simple. So I took over a role of trying to improve our badger summaries on the neonatal unit. They just were never completed. And then when you were the poor person on SCBU and a baby needed to go home, you had like a 60-day stay neonatal unit to fill in on the badger. And a colleague had done it before me, so the previous kind of 6 months, and it just had been unsuccessful in creating the change. And so things I learned was that actually kind of working together as a team, and you may only have done 2 weeks of SCBU in your entire 6 months. So you may not have realised the impact of not doing the badger summary until you get to SCBU if you haven't done many shifts on SCBU. And actually, we were trying to improve something, but we hadn't asked the people working on the floor, guys, how do you think we could improve these badgers? What do you think we could do? So it was things like that that I put into mine about creating change. You need to make sure that you've motivated other people. And it's just kind of thinking about your projects in a little bit more detail before you have to fill in this form for real, so that you have an idea of how you would answer them. So the next one is research, and people really worry if they haven't done research, but a lot of consultants, I'd say the majority, particularly outside of grid training, have not done research as a trainee. But the question asks, if applicable, so it recognises already that not everyone will have done it, but it has to be over the last 5 years, and you can list a maximum of 5. So if you've done an MD or a PhD or a master's, then great, you can put that in there. If you haven't done any specific research, rather than leaving it blank, you could mention, if applicable for you, if you've done any consenting for trials while you've been during your training, if you've completed the good clinical practice, which we'll get to in a minute, is a basic framework for how to conduct research properly. You could put that in the form. And you could also mention, you're not going to score points for this, but it's the person reading the form gets a better idea of you as a person. So you could say that I haven't partaken in research during my paediatric training, but I very much look forward to being involved as a consultant. And if you then know that the department you're working at is currently involved in X trial, or there's a particular consultant with a research interest, you can show that you know that about the department by saying, I particularly am looking forward to hearing more about X trial that you're doing or becoming involved. Do you hold any particular qualifications in research? For those of you that haven't done particular research projects, this will be empty, so it's not like you'll have an MD or a master's. But there is an easy thing you can do to have an answer for that box, and it doesn't take very long out of your time at all. So the good clinical practice e-learning is informed consent, can be done free online on the NIHR website, and the link's there, but also if you just Google GCP and NIHR. And I believe with the new shape of training that this is actually going to become mandatory anyway. Someone just put a question on, so let me just check. Hang on 1 second. Katie, so yeah, she's saying that what I've just said, so the new curriculum will include GCP for everyone. So just to make sure that you have done it. Obviously, if you're someone who is ST8 this year, it's worthwhile trying to see if you can do it before you apply for your consultant job, so you can add it. It is very quick. It'll take a maximum of an hour to do it. So the next one, again, is the ones that people are really worried about. So publications, prizes, and presentations. And you can list up to 6 of each. So publications you either have or you haven't got them. Do not think that every person that applies for a consultant job has them. They don't, so do not worry if you're leaving that one blank. Just remember for the prizes that it can include medical schools, so there's no date restriction on this. So if you're someone that got distinction or you got a certain prize at your medical school, you can put that in. And then the presentations, you list up to 6. And again, think about which ones you're going to put on there. So all of you will have done far more than 6 presentations by the time you get to the end of ST8. Think about what makes them stand out and what's going to score you more. So clearly an international presentation will be better than national, which will be better than local. So if you've got international and national, put those there first. If you haven't, or if you're getting to your ones that are local, think about the local ones that add more weight. So think about ones that were significant projects or ones that affected change, such as you presented your audit findings to a department and that resulted in a change of something, so a change of the guideline for that unit. That would be more significant, and you have room in the box to give the title, where you did it, and why it was important. So you can say presented the audit findings to the neonatal department, which led to XYZ. So the next one is management and leadership experience, and just really note that it asks you relevant to this post and not necessarily limited to professional activities. So it does want to know about your leadership experience within paediatric training, but it does also want to know if you do anything outside of work that could make you more employable. So like we said, courses, if you've done a leadership and management course, remember, try and do it in the last 3 years prior to applying, so it counts on the form. If, let's say, you are ST8 now and your leadership and management course happens to have been 4 years ago, in the courses section, you couldn't put it in because it will only let you put things down to the last 3 years, but you could still put it in the answer to this question because there isn't a date restriction for this one. So think about your clinical leadership. So all of you will have run, by the time you're ST8, a busy NICU with a night shift. You'll have run a busy A&E department. That is clinical leadership and management. Think about other roles you may have had. So you might be trust rep, you might have been grid training rep, you might have had a role within your department. To develop a new teaching or course, that again you put in the teaching section, but it is also a demonstration of leadership. Lots of you are involved with the LSP trainee committee already, having noticed some of the names. If you're not, and you're not an ST8, so you have more time, think about whether that is something you'd like to be involved in and whether you wanted to apply for that in future years. But also remember, don't just do something, have it on the form. Do it because you want to be involved with it. And being in that trainee committee is really useful for making changes within paediatric training and also kind of just a general understanding of how training works. If you were in some sort of committee in medical school, again, there's no limit in terms of years on this form. And think about clinical governance. That is also management and leadership. So have you written any guidelines? Have you updated any? Have you taken part in any mortality reviews? Helped handle any complaints or an SI review? So again, if you've got time, ask the departments that you're going to work in. If this is an area that you're less familiar with, ask them to get involved. Lots of trusts hold their own root cause analysis training. That's also important for management in terms of dealing with complaints. So make sure you ask your trust. It's normally a 1 to 2 hour face-to-face or online learning that you can do. Again, leading projects that affected change, that's management and leadership. And then think about other things. So personal, is there any of your hobbies that demonstrate medical management and leadership? So are you the captain of a sport, or do you kind of do anything outside of work that you could say involves management and leadership? And the same for a research project. And what you want to highlight is not just say, I have been trust rep, I've been part of the LSP trainee committee, I've done this, I've done that, but what you've done and why that's given you the experience. So what it's taught you. Did it teach you how to negotiate with your team members to reach a conclusion in a plan? You know, if you're doing leading an SI review, did it teach you how you do root cause analysis? So you need to demonstrate not just that you've done something, but that actually it makes you more employable as a consultant. The next one is describe situations where you've been involved in working in a team. And this part's in bold, not necessarily limited to professional activities. So they want to know more about you as a person and they want to know about your team working. So think about work, whether you could use an example case, such as an emergency. So did you have a DKA that needed resuscitation, or a child with really brittle asthma that had to go down all the IV routes, or a full resus of a baby born without a heart rate? Anything like that that would involve you working as a team, or something like discharge planning for a complex patient, then you could use that as your example. Think about, there's a lot more focus on families and being in partnership with them. So any question on team working should be including your colleagues as well as families. Team working could be thinking about supporting your colleagues in resilience training, so making sure that you offer a debrief if you've had a difficult resus. And a big tip for this question is look at the desirable criteria, and anything that you haven't been able to mention, or if you have already mentioned it, the things you want to highlight even more, is think about how you could get the desirable criteria into these sorts of questions. And then the last part of the form is the supporting information, and it's basically your free will to add onto the application form what you think sells you. It's about selling you over the other candidate. It's things you haven't already mentioned, or because of the word counts, you want to add more detail. So just a simple thing, think about where you're applying. So London is a really multicultural city. So if you've got any experience of working abroad and dealing with different cultures, then obviously that adds weight to your application form. So think about anything that you've done as part of your paediatric training or before that makes you more employable to the area that you're applying for. You may or may not have a chance to write about research in enough detail. So if you've done lots, you might need to add that in. Thinking about mentoring and supporting colleagues. So you might have been part of the Paediatric Families Project, or you might have offered informal mental support, and that won't have come up in previous questions, but is important for a consultant, so you can add that in. Again, go back to that desirable criteria, and if there are any that you haven't mentioned in the form, that's how you need to kind of bring it back in to your application form. And think about anything outside of work that makes you different and also adds to your application. So I teach fitness classes outside of work, and so I added that into my form and kind of implied why I met some of the desirable criteria, but through teaching that rather than just paediatric training. And I cannot stress enough how important your closing paragraph is. They may have read 40 application forms for one consultant job, and they will obviously remember it all in terms of they make notes as they're going through, but this gives them their lasting impression of you. And make sure that you tell them that you know about their hospital, you know about the trust values, and that why they should hire you. And I don't expect you to read my answer, but that's my answer. And I'm sure people could write far better answers, but just make sure that your closing paragraph really sells you and why they should employ you. So just before I go to the last bit, which is just to give you a few tips of the consultant interview, I'm just going to check the chat because another one has come up. Just going back to the 3 to 5 year bit. So yes, it applies for full-time and less than full-time trainees, but the less than full-time, obviously your 3 years isn't going to be the same. So it's looking at your training time for the less than full-time, and that's what the information button will tell you on the questions. And yeah, you can definitely include things that you've done on UPs, whether it be an UPC, UPE, or UPAR. So the consultant interval, let's acknowledge it's stressful, it's really daunting, and even if you're the most confident person in the world, you're going to be really nervous about it. But you can prepare. They all take the format of a standard interview with a large panel, including consultants in the department, the chief exec or a representative, a member from the college. You may or may not have a stakeholders interview, which is from the rest of the team. So kind of having representatives of the senior nursing or allied health professionals in the department. And some consultant interviews will ask you to do a presentation, which you may get information on in advance, or you may get given on the day. So just in terms of preparing for it, ask colleagues to give you interview practice. Don't be afraid to do this. And even if you think you're the best person at interviewing and you don't get nervous, just practice, because the way you're asked questions in the consultant interview is nothing like someone putting you on the spot like that. And you may be able to sell yourself brilliantly, but the way they ask the question, you might miss the point if you've not practiced it. I would definitely recommend an interview course if you can. Again, even if you think you're really good at interviews, it's really good at explaining why they're asking you certain questions, giving a framework to answer them, so you just get a bit more confident in how you would approach them. And then think about what you need to know about before the interview. There's absolutely no way you can learn everything. Make sure you know the NHS structure though, and the King's Fund website is the easiest way to do that. Any documents relevant to your specialty. So for me at the time, it was the Neonatal Transformation Project in Attain. You will know if there is something very topical for the department that you're applying for. And if you don't, ask the consultants there. Personally, I think Shape of Training and Progress Plus is going to be a big topic. And there's obviously a 10 to 15 minute YouTube video with the link there, which you can also Google if you do shape of training. And I think it's important to know what impact that will have on our trainees as well as us as consultants. Make sure you know your hospital's values. It will be in the information you're sent out with the application form. Ask consultants in the specialty you're applying for what they think might come up, and ask new consultants what they were asked. So if your friend got a consultant job last year, make sure you ask them what they were asked. And again, this is why I said I'd give you the slides, and obviously it's being recorded. I don't expect you to remember this or write it down, but these were the questions I was asked. And I guarantee you, for example, I would never have thought of how would you integrate neonates with primary care. I would never have thought of that in my preparation. But because I'd prepared differently with frameworks and thinking about things, you're able to think on your feet a bit more. And my stakeholders interview was with 4 of the nurses, dietitian, physiotherapist, and a couple of the other consultants. And they basically, the stakeholders interview is more to get an idea of you as a person. So it's asking things about teamwork. How would you go about doing things in the department? How would you handle someone who's had complaints? And that's the typical question you'll see is, what would you do with a trainee in difficulty? How would you approach a consultant who there are lots of disagreements with that you'll see in kind of if you Google consultant questions? So just some things to think about is go through your CV and be able to say 2 to 3 minutes about you and what you've done during training. And when you say this, think about splitting it into the camp structure, so clinical, academic, management, and personal. Because the first question your consultant interview is always something like, talk us through your CV, tell me something about you, and that's what they're getting at. Start preparing early, even if you've not got a consultant interview. And they won't necessarily ask you these sorts of questions, again, that I've listed here, but thinking about these questions will help you answer what they do ask. So it's quite common for someone to be like, what's been the highlight of your training? And if you've not actually thought about that before, that can throw you off as the first question in your consultant interview. They don't ask, tell me a strength and a weakness, but it can come up a bit like the question after the procedures when it's like, what's an area you would like more experience on? So just have a think about things. One of the common questions that 2 of my colleagues got in the same year was, tell me about a clinical case that will change your practice as a consultant. So it is really worth thinking about those memorable cases that you will kind of have an impact on you. But just a word of caution, don't become someone that's literally read through every possible question in every possible book and have an answer. Because we all will have a tendency of behaving a bit like a robot when we're learning a rote answer. You want to make sure you know what project you've done, and you know what sells you, but in kind of a generalist way so that you can then answer any question rather than rehearsing a 50-word answer to every possible question and then getting stressed because you can't remember what that one sentence is at the end. And just the closing things for those of you that are rapidly approaching applying for a consultant, make sure you attend your department's consultant meetings. Most departments let ST7s and 8s join. If you are a post-start ST7 or an ST8, make sure you join the Stepping Up group in London. It's really good. It talks about the CCT, the applications, how to find information. And you just need to email steppinguplondon@gmail.com to join. And they've also created a document on the CCT questions, how to fast track, how to act up. And think about what opportunities you can do in your final year to act like a consultant before you transition. It could be something as simple as how you would have dealt with a patient versus how the consultant did it. You could have formal arrangement with consultants to do solo lifts or clinics or ward rounds where they're not actually with you, but they'll speak to you afterwards. You can act up informally. So in my ST8 year, I acted up informally in that there was a designated consultant, but I acted up as the consultant for a week with that consultant as backup. And there is the option to act up formally. But you need to be really organised for that, and it needs to work for the department because you wouldn't be on their reg rota. So you need to think about it really early on. And there's a really nice advice about acting up in the Stepping Up London guide. And just for those of you who are current ST8s, just to check for your final ARCP, which will be next month. Obviously, the website's been updated this week and it has all the requirements, particularly making allowances for COVID. but it's all the obvious things. You need to have made sure that you've got all the SLEs, you've got the appropriate MSF, you've done your NLS or APLS, and if it's overdue due to COVID, make sure that you make that clear, and if you're trying to book on a course, put that on the form. Other things where mean your outcome 6 is delayed, which will delay your CCT, is the CCT calculator. Really double check it. Having been on the ARCP panels, people overlap the dates or there's gaps in the training. So just make sure that your dates are sequential. And then the final tip for those of you, and this came up a lot in the last ARCP, for your clinical supervisor report, they need to say that they A, support your CCT, but also your supervisor needs to click on each level 3 learning outcome on your dashboard and mark it as achieved. So sorry, I'm not sure how well these have shown, but this is the overall review, and the supervisor puts here achieved, achieved, achieved next to all the competencies. So all these learning outcomes have now been signed off. This is someone's ARCP where the person was brilliant, the form supported them for CCT, but the supervisor hadn't clicked these as achieved, so they still stay here as in progress. And so that means that you can't be issued your outcome 6. So just make sure that your supervisor is aware when you go to your meeting in June. For those of you who are SD8, ask them to do this. And if for any reason you've already had it done or you forget, you just need to ask them to do it retrospectively after you've submitted the form. And then you email the RCPCH e-portfolio email that's on the website, and then they can mark it. You can't do it if the supervisor hasn't done it. So the main thing I want to say is think about where you want to work early. Think about why you want to work there, why you'd fit in and what you could offer. And if you're a person that's not sure, think about locum posts or post-CCT fellow posts to give you experience in places you've not worked. Start that RCPCH CV early. Think about the questions on the form early. And I can't advise enough about interview practice, however confident you are. Make sure you ask people who were in your position last year. They're the best people placed to give you the advice. There's a really nice BMJ article giving some brief tips on how can I smoothly transition from trainee to consultant. So that's worth reading. And the final thing I want to give you, because if you're like me, that SD8 year was just really daunting. I'm really nervous. But this is the final line of that BMJ quote, and it's so true. So nothing has changed. So the patients or the illnesses haven't changed. You've done 8, if not more, years of training, and it's natural to be too nervous when you're stepping up, exactly how you were when you went from SHO to registrar. But you've all totally got this. And the form and the application process and the interview are just about selling you. And you don't have to have done a million amazing things. You just need to explain what you've done and why that makes you the best person for the job.